the proportion of GDP that will go on our health service in coming decades, currently 8%, will rise to 20%. That's a function of increasing longevity, improving technology. The bills are going to keep going up and through the roof, and your solution is simply to keep on rising taxes to pay for them. Our survey today says only 30% of people support that strategy. But the health chiefs, of course, we surveyed them too, they all love the idea, but they would, wouldn't they?
Well, I don't recognise those figures as being credible, 20% GDP in terms of health. Well, this is a government, this is not independent, this is a government voice box. The policies that we are pursuing will divert more money away from patient care. That's the fundamental problem which you don't seem to be grasping. The amount diverted away into administration costs and profit for corporations who are increasingly slicing open the NHS are increasing, and that is taking money away from the front line. And that's the fundamental thing that Lord Warner refuses to answer. And, you know, he published his paper through Reform. Well, let's look at the links that Reform have to companies and corporations that will profit from privatisation. You know, outsourcing companies, big pharma, private health insurance companies, McKinsey's, management consultancies. These are the companies that are profiting whilst creating the myths of unsustainability and the NHS isn't working. So we're having a drip, drip, drip propaganda against the NHS because they'll find it hard to reform and privatise something that is functioning well. Okay, the government is deliberately underfunding the NHS, and that's the fundamental truth.
Trying to keep this balanced. Lord Warner, you get the last word.
Well, I think that we've got to actually face up as a country to the fact that we've got to change the NHS. That doesn't mean going down a privatisation or insurance route. It does mean treating more people in the community, a better deal for social care, which I would criticise this government for, in the way they have actually starved local authorities of the money for good adult social care. But the idea that we can go on just raising general taxation and national insurance is frankly fanciful. There is a public resistance to it, and a good reason for that, because they are taxes on jobs. And we don't want to do that. Unemployment is really bad for your health. So we can't just raise taxes.
OK, gentlemen, we've got to wind it up there. That seems like the right moment. Lord Warner, Bob Gill, thanks both very much indeed.
Thank you.